Hello guys, welcome to my channel. So today we're going to discuss about wrist examination. So first to know how to measure swelling. If a person comes to you and they have swelling in the hand, then you can use a simple inch step to measure the swelling by a figure 8 method. You can use to first you can measure in the normal side, then compare to the abnormal side. Then what are the movement of wrist? The movement like wrist flexion, extension, radial deviation and ulnar deviation are present in wrist. So for measuring a range of motion, we have use a goniometer for that, and for that we have a moving arm, stationary arm, and a axis. So for wrist flexion and extension, the stationary arm is parallel to the ulna and the axis is in tricutum, and the movable arm is parallel to the fifth metacarpal. Then and same for the wrist flexion also. So normal wrist flexion range is 0 to 90 degree and wrist extension is 0 to 80 degree. Then for range of motion of ulnar and radial deviation, the stationary arm is parallel to the dorsum of forearm, and the movable arm is parallel to the third metacarpal bone, and the axis is in capitate. And we do the radial and ulnar deviation. So for radial deviation, normal range is 0 to 20 degree, and for ulnar deviation is 0 to 35 degree. Then MMT of wrist joint are like wrist flexor, wrist extensor, ulnar deviator, and radial deviator. So you can see the grading where you can know how much the muscle have the strength. Then for MMT of wrist flexors, what are the wrist flexors? The primary muscles are like flexor carpi radialis, flexor carpi ulnaris, palmaris longus. So the position of the patient is in sitting position, forearm is supinated, arm is fully supported, and the then we just do the wrist flexion. If a person can do by herself or himself, then it grade 3. If a person can't do, then we give it in a mid prone position and do wrist flexion. And if not doing in mid prone position also, we just palpate. And if a person can do, then we go give resistance to the dorsum, palmar aspect of finger, and give a minimal resistance for grade 4 and maximal for grade 5. Then for wrist extensor, the primary muscles are like extensor carpi radialis, extensor carpi ulnaris, and extensor carpi radialis, brevis and longus both. So position of patient is sitting, forearm is pronated, and we ask the patient to do extension. If patient can do, then it grade 3, and if patient can't do, then we place it mid prone and do extension. And if patient can do, then we give minimal or maximal resistance, and the resistance given to the dorsum of finger. Then for radial deviator, what are the radial deviator muscle like extensor carpi radialis, flexor carpi radialis are the main radial deviator muscles. So just place the patient is in sitting position, arm is mid prone position, and just ask to do radial deviation. If patient can do, then we give minimal and maximal resistance. If patient can't do, then in place the arm in supinated position and do just radial deviation. Then for ulnar deviation is also we give the ulnar bone in above and radial bone in below and in mid prone position. And then we ask the patient to do ulnar deviation. If patient can't do, then give minimal and maximal resistance. If patient can't do, then in supine position, in supinated position, you can do just the radial do the ulnar deviation. And the muscles of ulnar deviator are like extensor carpi ulnaris, flexor carpi ulnaris are the major muscle. Then for joint play, in wrist they have wrist distraction, wrist anteroposterior glide, and wrist ulnar radial glide. So we can know previously the grading of a range of joint play. So first we go for the wrist distraction. For wrist distraction, patient is in sitting position, forearm is pronated. One hand of the therapist hold the wrist, and another hand hold the metacarpal. Then give slight distraction. Then for dorsal or anteroposterior glide or ventral, it also called ventral and dorsal glide. So for dorsal glide, the forearm is pronated. Therapist hold the one hand up the wrist and other hand the palm, and force apply upward for dorsal glide, and same position force apply downward for ventral glide. Then for radial and ulnar glide, the patient place the forearm in mid prone position, hold in one hand at the wrist, other hand in the palm, exert lateral force for radial glide and medial force for ulnar glide. Thank you.